Okay, well, we want to welcome you to our first ever Lunch and Learn, where today we'll be talking about one of our vital programs that we provide through Prototypes and HealthRIGHT 360, our parent company. My name is April Torres, and I am the Vice President for Behavioral Health Services for HealthRIGHT 360, which is the parent company, as I said, of Prototypes. And today I'm joined by Nancy Chan, who's with the Los Angeles County Public Defender's Office and has been an awesome partner of ours for the Women's Reentry Project. And we will also be joined by one of our incredible alumni of the program, who will share a little bit about her experiences as well. Nancy?
My name is Nancy Chan, and I'm with the Public Defender's Office, and I have been working with in the collaborative courts for quite a while. And the collaborative courts are alternative treatment courts that address the needs and issues of people coming into the criminal justice system and divert them out into services with the intent to not only help them with the issues that brought them in, but keep them entirely out of the criminal justice system. So I'm happy to be here.
Awesome. And has Nicole joined us?
Yes, I'm here. Good
Okay.
afternoon.
Good afternoon, Nicole. If you want to just go ahead and introduce yourself, and then we'll get going.
Good afternoon. My name is Nicole De La Torre. I'm an alumni of the Women's Reentry Program and a grateful recovering addict. I'm happy to be here.
So just to give you a little context, Prototypes is part of a larger behavioral health organization, HealthRIGHT 360. In our program in Southern California, Los Angeles County, we have been fortunate to have a very innovative criminal justice program to serve women who have experienced incarceration and have complex needs. And therefore, we're having challenges being served by other drug courts or other systems. And so we came together to look at how we could provide services to these participants who would otherwise be denied, access to care. And we're really cycling through the prison system over and over and over again. So we really wanted to look at how we could serve those participants. Prototypes provides residential substance use disorder treatment, outpatient. We have a full continuum of care, which includes outpatient mental health and substance use disorder services, plus we have a housing component. So it really is situated in terms of being able to provide that continuum for the clients to address every need that a participant might have. And so I think that's one of the things that contributes to the success of this particular program is that we were able to provide services through that entire continuum. As we know, incarceration rates for women were increasing. At the time we started this program as a pilot in 2007, and really wanted to our goal as for Prototypes has always been to serve those who are underserved or not able to otherwise be served. And so we saw this as a perfect opportunity to collaborate with our partner in the Public Defender's Office, Nancy Chan. And I just really felt like as we talked about this program and looked at what we could do, we really wanted to serve those that were being turned away from other courts and being sent to prison over and over again. And so this was a ideal solution in that we could divert them from jail and hopefully provide them with enough services and support for them to be successful. And it's incredible what it's been able to do. So, and I've told Nancy, I've told people this for years. This is one of my favorite projects. I've been doing this work for over 30 years. And this is one of my favorite projects that I've ever been a part of. The clients that we serve have the most complex issues, the most complex trauma. to the point where it almost became a joke with Nancy and I, that she would just, it was almost like she would go and find the most difficult case, either from a criminal justice standpoint or mental health standpoint, or, a combination of everything, and say, okay, here, now help this one. And, it was, it has been a wonderful experience. And the best thing about it is to see these women who, some of them had never even seen any kind of care or treatment before, only the inside of a prison. So that's been amazing, but I'll let Nancy share from her perspective.
Yes, it's definitely been a labor of love for our clients. So just to follow up a little bit on what April said, is the majority of women who are in custody meet the diagnosis criteria for serious mental illness, post-traumatic stress disorder, and/or substance use disorder. And the majority of our clients have suffered from multiple adverse childhood events. So they've witnessed, they've been abused. Most of our clients have suffered severe childhood abuse, physical, sexual, emotional abuse, neglect. They've been taken out of their homes. They've been, subjected to horrific treatment by their caretakers, including being sold into trafficking. They've witnessed domestic violence and outside violence in their homes, and they have then often gone into domestic violence relationships as they became adults. Let me see. So between 60 and 80% of our clients, of women in prison, rather, are mothers. And so the collateral consequences of putting a mother into custody, affects the entire family and can create multi-generational trauma for the children who are often placed either into foster care or other housings. And when women are in jail, and I can't describe enough the cruelty of just jail itself. And the majority of women in custody are actually pre-trial. They haven't been convicted. But CRDF, sorry, I know it well. I mix it up with CDCR, but CRDF, which is a women's jail in Los Angeles, is in a closed jail, which means that there's no outside programming. So the women, it's a freezing place. It's very, very cold. And when children come, and it's very regimented, so it's concrete, it's glass, it's cold, it's uniforms, it's not enough blankets, it's, a lack of all kinds of things that women need. And still, I can't specifically speak to CRDF at the moment, but even getting enough menstrual supplies is a challenge. I'm getting a diet, an adequate diet is a challenge. And so when a woman's incarcerated and she's a mother, her children can only visit by appointment. They can't all come to the visits. There's a very, very small program of on-hand, of touching visits that exists at CRDF, which I believe has been suspended during COVID. But the majority of the children who visit their mothers have to do it over phone through glass, sitting on a metal stool while their mom sits on a metal stool across from them in a uniform. So, so just the devastation of seeing a mother incarcerated along with all the other collateral consequences is huge. So Black women are still overrepresented in the jail, and they have been since COVID. In fact, the proportion of Black women in the jail has increased proportionally to other people in jail. And just going back to the children, what I neglected to mention is the phone calls. If a mother's calling her child, she has to call collect, and those calls are average about 3 times higher than the price of a normal phone call. So, the system really does just tear apart the ties that the mother, who may be the primary caretaker of the children, can even have with her children while she's in custody. And I think we can go to the next slide.
All right. Nicole, did you have anything you wanted to add as it relates to that?
Yes, I just wanted to add, I completely agree with everything that yourself and Nancy just shared. Substance abuse does start with, the cycle of addiction. It starts with, social using, not recognizing that continued use it does turn into all of those things, PTSD, depression, mental health issues, domestic violence, and get those issues at hand, and also being pregnant, being incarcerated, having to deal with the surroundings and the other women, and feeling like not having the family support, not being able to go to proper doctor's appointments, not being able to seek proper medical attention. There was times being incarcerated where we didn't even have running water. We had to flush the toilets with tubs of water. Like, the water wasn't even running, the cells were hot, the air conditioner wasn't working. So I just have to agree with everything that Nancy's saying. The conditions were not fit for somebody that is carrying a child.
Thank you, Nicole. Next slide. So as I said, in 2007, sitting around a round table trying to figure out some of these complex issues, we really thought that there has to be a way to provide an alternative to incarceration and get these people the services that they deserve. And I know a question came up in the chat that asked, why wouldn't they be able to get services elsewhere? In most of the cases for the clients that are served in the Women's Reentry Court, they have some kind of circumstance that would preclude them from being involved in other drug courts, either their criminal charges, or maybe their mental health, or maybe a combination of both. And so we wanted to be the place where those participants would have a chance and have access to treatment. Next slide. So as Nancy said, it's a collaborative court, which Nancy is the expert of that process. But from my perspective, I think the collaboration is what makes this program and this partnership so amazing, in that we partner with the justice team, the court team, which includes probation, the court, the judge, and the participant with a treatment provider. So it's a collaborative process with everyone working for the client's good, right? And for their success. And I think that's also one of my favorite components about this project, is just to see those entities all working for the success of the client, and then seeing the client actually transform to see, like, people that have kind of been a negative influence up until that point in their lives turn into something positive and be able to see the other side of it. So I think that's transformational for sure. Nancy, did you have anything on that?
Sure. So what happened from my end is I was working in a drug court, and I'm a lawyer, I'm not a clinician, but I had a client who came up to me in tears, and she said to me, they won't let me talk about being raped until I'm clean. And so I knew that was wrong, but I didn't know what was right. And so I ended up contacting Prototypes and another program that served females. And and so I asked them, what is better than this, and that's how I met April. And so I started doing some work with some research with UCLA, doing random assignments of gender responsive treatment versus mixed gender treatment and so forth. And I was able to come out during part of that process to see Prototypes in person. And they had just built some new beds, or a whole new wing full of beds. And I remember thinking to myself, those are my beds. I'm going to get my clients into those beds. And so,
said that, yeah.
And I told April that, and you're never getting rid of me. And so what happened is there was a push by a reporter to address the recidivism rate in Los Angeles, because the recidivism rate coming back from prison was at 70%. And this reporter basically threatened LA County officials and state officials and said, I'm going to write a book, and y'all are going to look really bad if you don't do something about it. And so people talked around the table for actually a couple of years, and finally decided on women. And that's when April and I got together and basically created the Women's Reentry Court, or designed it in a day. And so we had a researcher from UCLA, who Dr. Nina Messina, The beds are where individuals sleep during residential treatment. So I'll let April explain that more at the end. So we created the program basically in a day. And one of the researchers from UCLA ISAP, Dr. Nina Messina, wrote us our first grant, which was actually to private entity. Then she wrote it to the prison, and the prison funded us. And we, created it basically from there. Go ahead, April.
Yeah, so once we were able, we got CDCR to fund it, and by funding, that's for the residential component, residential treatment beds. So at that time, for our first contract, CDCR was funding the residential treatment days. So not sober living, but actual residential treatment days. And then from there, after they completed residential, then we provided them the full continuum with our housing and outpatient or housing partners. So not all situations, because we only had 36 units of housing. So we would partner with community partners to provide the sober living type environment once they're in outpatient. So they would be referred into the residential program for a period of time based on their needs. In the beginning, it was like they would stay in residential for a year. And then as funding changed and years gone by, treatment stays in residential became shorter. And so we had to bump up more comprehensive care in outpatient and ensure that they have safe exit in sober livings and stable employment and those kinds of things. Next slide. So as I said, it's a collaborative process between all of these entities, and again, from my perspective, that's one of the most amazing things. I'll never forget, one of the most striking, in the beginning of this project, I was very involved. I was at court with Nancy every week, at the table in the meetings every week. And one of our first times when we took a busload of clients to court, we got off the bus, the bus pulled up out front of the criminal courts building. The bus pulled up and we got out, and a client grabbed my arm, and in fear, I could feel the fear in her arm. And I said, what's going on? And she said, I've never entered a courtroom through the front door. And that just struck me like, oh my God, I realized, everything I'm taking for granted here, like this is such, the magnitude of that was huge. And it impacted me like I can't even describe, and that's what this program does. As I said before, it having that collaboration of all of these people working on behalf of the client, when clients feel, our clients, the people that we're serving, have felt like these people have always been against them. And to see like this, that's not the case. These people are caring for me and making sure I have what I need, is just transformative. And just that moment with that client, I could say that I think that changed my life. Like just hearing that was just so impactful to me. But anyway,
can I jump in real quick on that?
Sure, of course.
So when we started this program, we didn't want to define the people by what they were charged with. And so unlike the prior drug courts, we're getting a lot of women in who, have horrible on paper cases, where they're charged with kidnapping, where there are weapons involved, where there's all kinds of stuff where they were not cases that typically were diverted into treatment. But because prototypes screenings would be by a screener and then again by a therapist often that would explore and sort of draw out the trauma, that without fail, there was such high levels of trauma involved in the clients that we were bringing into this court. It was unlike anything that had happened in the Superior Court in the entire county, and as far as we knew, the entire state or even the country. But in the very beginning, I was used to working with a provider who was very strict, and if the clients didn't do exactly what they were told, they were often kicked out of treatment. And so when I would go out to prototypes, because we'd have staff meetings every week out there, and I would spend every Tuesday at prototypes, I would see my clients, and my clients were complaining and, and writing up, reports of violations. And, they were just generally, often, quite disruptive, during treatment. And I used to actually hide from April when I would go out there, because I was just so afraid that she would like end the program, because these were just people with a lot of issues and a lot of needs. And, and I was used to treatment, not putting up with any of that. And so it wasn't until, as April mentioned, it wasn't until, I would see her and I would go behind a wall, because I was like, if she can't see me, then she can't stop this program. Of course she could, but that was my thinking out there. And, and then one day April told me this was her favorite program. And it really was, and I think that's when we both started to realize the magnitude of what we were so fortunate enough to be involved in, to really change lives of, excuse me, of the people who got out there, and what a system change it was to have this opportunity to have, gender responsive treatment for women, available in Los Angeles County as an alternative to custody.
Nicole, anything to add?
Yes, I wanted to add a couple things. This was the very first time in my life that I had dealt with a system where I felt like everybody was advocating for me in my best interest and the interest of my child. It was the first time that I entered a courtroom and I didn't feel like I was viewed as a criminal, but as a person that was suffering from a substance abuse problem and could benefit from some help and some treatment and some groups. And, when I first signed up for this program, what I did know was that I had made a mistake. I didn't know how to stop using drugs. I found out that I was pregnant, and this overwhelming, feeling came about because I said, man, I'm about to bring a child into this world, and look at these mistakes that I made, and how can I ever be forgiven, and what can I do about this? And the courts gave me that opportunity, in lieu of a 5-year prison sentence. They gave me an opportunity to enter prototypes, where I'd be able to give birth to my child and be able to bond with her the way that she deserved to be held by a mother, and not chained to a prison bed and my baby taken away from me immediately after birth and all these other things. So I knew that when I accepted prototypes, and I accepted a joint suspension, which was like an alternative, okay, here, we're going to give you this chance to go to this program and make something better with your life. And if not, you do, because of the consequences of your actions, you do have this prison sentence hanging over your head if you fail to complete this program. And so I agreed to those terms, and I got this opportunity to go to prototypes where I was able to give birth to my child, bond with my child. I was able to have many women role models in my life to guide me and to show me that there was a better way. I didn't realize that I wasn't just accepting a program in lieu of a prison sentence. I was accepting a life change that was going to affect many people to come. I didn't even realize the depth of what I was doing when I made that decision at that time. It was bigger than me. It was bigger than just being able to have my child. It was going to set me onto a path that a picture I couldn't even paint.
Okay, next. You got me, Nicole. Watch it. Next slide, please. Oh. So what's unique about the program? We're able to, as we've already mentioned, there's lots of unique things in terms of the taking the cases that are challenging for many reasons. With this project, especially in the beginning, because we were getting many women who were otherwise facing life sentences. They had, histories of trauma. And mind you, I've been doing this work for 30 years. And this program really, highlighted the fact that, we weren't even touching the surface of some of these women and the histories of trauma that they've been through. And they've been just cycling through the prison system their whole lives. Most of the participants in the very beginning had spent more than 2/3 of their life in prison and had never seen treatment previously. And, you know, just hearing the things that they had been through, and just the awakenings that, as Nicole just described, that they were able to experience that they were not anticipating, was just to watch those miracles happen, is just, there's nothing more rewarding than that as a provider. Next slide. So most of our participants that go through the program, they are assigned, you know, they're followed by that team, that collaborative team that we talked about. And the team meets on a regular basis every week, in fact, to talk about the progress of the participant, to involve the participant. If the participant is struggling or not progressing, then they might bring the participant into the process. And really, it is a collaboration between the team, the court team, the treatment team, and the client, and then the court. Once we get to the court, the judge is also involved in that collaboration and working together for the success of the client. And from, as I stated before, it's a continuum of care. So they go through our residential component, and then transition into aftercare or outpatient, and then aftercare. So altogether, they're in services now, especially drug Medi-Cal. Drug Medi-Cal has changed the length of stay for a residential component. So I think the average stay for the women's reentry right now is probably 4.5 months. And then they transition into a level of care, an outpatient level of care, which is generally in the beginning intensive, and then steps down to a lower level as they go. During that time, they're provided case management and support to get employment. That's one of the key things to the success of this program too, is working with these participants to, you know, get back into or get into the workforce for the very first time in their lives for some of them. And then, just as I said, the court celebrating their milestones and working together with them and creating this positive relationship now with the law enforcement side of this is hugely pivotal for them. Nancy or Nicole, either one?
I just want to agree with you 100%, April. Like the fact that so many people come together for the greater good of their clients is one of the most amazing things that I've ever experienced in my life. Like I said, it changed the entire course of my life, knowing that I had all these people on my side. Like, it wasn't out just for punishment. It was out to like really help me do something different.
And then oh, go ahead, Nancy.
Oh, just one of the milestones we'd have, it would be graduation, and that's where the women are celebrated for, you know, completing their treatment. And so the judge, you know, would read something and then read something about the women, and then the graduates would speak. And a lot of times family members have come to court who, you know, who our clients, you know, had lost contact with. You know, clients' children would come to court, and you know, to not just see the graduates themselves, but to see the family members, and you know, as part of the celebration, is also, you know, just shows the sort of collateral healing that can happen when someone is placed into treatment instead of incarceration.
All right. Okay, I think I'm trying to keep up with the questions in the chat as we go, so we don't have to do them all at the end. In terms of children in the program, children are allowed. That's one of the unique things about the prototypes programs, is that you know, women don't have to make a choice to either be a mom or get treatment. They can bring their children with them to treatment. And while they're receiving therapeutic services, their children are in a daycare-like setting. Throughout the day, it's established just like a regular day would. The woman drops their child off at daycare in the morning, and then comes back at the end of the treatment day to pick them up. And we have child care specialists that work with them on on building those parenting skills and those kinds of things. So definitely that is one of the unique things about our program that others aren't able to offer, is because we do allow for the children to be there with mom.
April, can I add something to that?
Sure.
I just wanted to add, I don't know if it's ever been brought to your guys' attention, but like the long-term impact that everything that you just explained had in my life and the lives of the people that I knew that went through the program was, we built these forever bonds. I built forever bonds with these women, with the women having their children into the centers while we attended groups and stuff, and the women having the opportunity to care for the children, for each other's children. After leaving Prototypes, it was like we were like a family. And now I had a bond with a bunch of women in recovery who were mothers and who are on the similar journey as me, and they became my forever friends. And our kids grow up together, and I am still in contact with these women, and I've seen their children grow, and they've seen my children grow. And it was like one of the most amazing things about that program.
Awesome. Well, thank you for sharing that, because that's yeah, that's an important point. All right, next slide. Okay, so yeah, trauma-informed, really important, obviously, because trauma-informed, gender responsive, all the things that we've talked about today. And what that means is just being, having an understanding of how trauma impacts the clients that we're serving is so critical, right? They've already been through so much, and it's important for us to come, come to them with a lens that understands that, and that we're not going to be re-traumatizing them or putting them through additional uncomfortable situations. They've had that enough, right? And so all of our staff are trauma informed and really trained to understand what that means. The gender responsiveness just means that, our programs are designed to support women with children, women that don't have their children there. Many of our clients do have children, but they don't have them with them. So, being sensitive to that, but also working with them on reunification and the things that come along with being a parent, even, when you don't have your kids with you or when you do. That increased social support that Nicole just talked about, really, even though it's a large campus, if any of you ever would like to visit, we can definitely set it up for you. But it's a large campus that can feel kind of daunting, maybe like I liken it to like a college campus that's big and it just feels overwhelming. But that's at first view. When you go inside, when you step inside the facility and you just feel the warmth, it's like a huge place that's a home, and I think because of what Nicole described, the bonds that they build with one another, it really is a family. And that's awesome. And that's what helps them to, be successful. Obviously, this is that whole, the feeling of family and support and just a place of healing. I think that's the best way I can describe it, is just the place of healing. Housing and employment services are addressed. We provide case management and help every, our goal once a women's reentry client is transitioning from the residential program is that she would have an educational plan or an employment, a secured employment by the time she transitions into sober living. So she's either going to go to school full time and participate in outpatient, or she may be needing to work because of paying rent at a sober living environment. So that's our goal with every client as they transition out. Next slide, please.
Oh, April, I just want to make a comment about the trauma before we move on. For me, seeing this program and the way that the program has, works with our clients and, and in such a trauma-informed manner and in honoring their histories, where people in the criminal justice system are called inmates, they're shackled, they're in cages before they come to court. There's, all of this dehumanizing factors aside from, they're called the defendant, they're not called by name, and all these dehumanizing factors that the system, is just, crunched up people. This, I feel like the Women's Reentry Report was a pivotal sort of changing point. It was the first, program to really get into who the human beings are that, that are before the court, and despite their charges, what has happened to people, what was their pathway in? And it's, it opened up a door, and it created, in a large way, an education system too within the criminal justice system, because as we would advocate for people to go to this program, where they could be healed, it was a humanizing factor in the system that in my experience didn't have many humanizing factors prior to it. And so, so just addressing trauma and recognizing the trauma that brings both men and women into the criminal justice system was for lack of a better word, a game changer in my experience. So I just wanted to emphasize that.
Yeah, no, definitely, Nancy, that's an important point. And I think having those services available to the participants, but also their children. The children also receive care and professional help while they're in our program. So I think that's an important point to make. And, just thinking back about some of the cases that we had and initially on the first look, for instance, I'll give you an example. Nancy brought us a client one time that when you hear the charge, she shot her child. Like, I'm like, no, Nancy, we can't take a client that shot her child. But when you look at the case, when we did the background, when we did, look at the circumstances, there was so many circumstances. If you just looked right under the surface of what really happened, which it was an accident, it wasn't really, but on the face sheet, it didn't show that. And so that was I bring that one up as an example because it was a learning experience for us where, oftentimes Nancy would ask me about certain kids. I'm like, no, we can't do those. Like, we can't do that. And then she would say, well, just try, just go and talk to them and just make sure, And so then after we would dig a little bit more, we would, figure out the reason why these kinds of things happen. And so I think, that was also really important for us to look at, those extenuating circumstances that really were rooted in that trauma and the unaddressed mental health issues that had gone unaddressed for so long. And I think just us coming together and making an agreement, okay, we'll dig deeper to see. And then if we agree, then we have to convince the DA. And that was a whole nother, whole nother layer of this, is convincing the DA that we weren't nuts, but yeah, so.
We traveled all over LA County talking to DAs, when we first started this program.
Yeah.
Yeah, and that particular client, she had, some pretty severe domestic violence going on. She had a lot of issues going on, and she wasn't an easy patient, at Prototype. She really wasn't. It took her a long, long time and she had a lot of there's so much going on, with this client, and it took her a long time to really immerse herself in recovery, but when she did, she transformed her life. Yeah.
Yeah. So that, I think that's the critical thing, is that, we took time to dig a little bit deeper and see what was underneath all of that. Nicole, did you have something to add?
Yeah, I wanted to add something real quick. I just wanted to say, I think that's amazing. Like, sometimes all people need is someone that's willing to give them a chance, somebody that's willing to take a chance on them. And that's the difference between life and death for some people. People die out there on the streets every day. People become hopeless, defeated, irritable, discontent, restless, unable to the pain just becomes so unbearable, of not knowing how to work through these emotions, not knowing how to work through drug addiction, not knowing how to work through mental health, how to ask for help, where to get help, and the fact that the Women's Reentry Program is willing to give people a chance is beautiful. It's definitely does so much. It empowers women, it empowers families. I wanted to touch on what you guys said about the visiting in the county, and it was being able to have my family visit me at the program helped me help my family bonds grow back together. My grandma, I'll share a quick story of my grandmother, who really didn't want anything to do with me anymore because I was incarcerated. she was so happy that I was getting help. She went to go visit me at Prototypes, and I got to spend my 90 days when I was at Prototypes with my grandma. You know, she came to visit me on the weekends. I got to go on passes to go home and see her. And it's kind of a sad story, but, you know, she ended up passing away the day that I completed Prototypes. You know, I lost her to pancreatic cancer, but being in the program gave me an opportunity to spend my last 90 days with my grandma clean. She got to see me as a clean and sober woman, and she got to meet my daughter. And, you know, I'm forever grateful for women's reentry and Prototypes.
Thank you for sharing that, Nicole. Next slide. So I'll let Nancy take this one first.
Okay, so we don't have the ability, the first 3 years of Women's Reentry Court, our funding was very, very unstable. And April and I would make trips up to the prison to try to get more funding. And we met with all kinds of people. There were times when we had no funding at all. And Prototypes would figure out a way to keep taking in Women's Reentry Court clients. You know, they figured out within their budget just to keep us going. And I'd have to say, April and I have marched all over the place to try to continue the funding, because it was so important that this program continued. So during the first 3 years, we kept some sort of crude data, because we really don't have the ability. We've had a couple of evaluations by UCLA, and then one by Public Health. That was more of a health evaluation, which was another reason why we were able to keep going and get more funding. And as was mentioned, we're now funded by Medi-Cal, so the cost to the county, I think, is extremely minimal. But the average incarceration cost in state prison right now is $81,000 a year. And that's average. So that doesn't mean that a person who's sicker, a person who's, you know, who's got more medical, person who has mental health is going to be a higher cost. And so I did, that number, April. I did a quick calculation. I talked to April. We estimated that about 3,000 women have come through the Women's Reentry Court. And so I did a calculation of the women having an average of a 3-year stay in state prison, which is not accurate either, because a lot of the women, like April mentioned, we're looking at life, we're looking at, you know, decades in prison. There were some who weren't looking as much, but most of our clients were looking at a lot of time. And so the number that I came up with was over $700 million in savings. I don't know if my math is right, but I'm pretty sure it was. And so, so the reality, if you just look at even if everyone was just $81,000 a year, even if they just did 1 year in state prison, other than getting this Medi-Cal funded program, if you look at like tuition at UCLA, you know, in-state tuition with maybe one kid living at UCLA and including books, that's a cost of 3 kids potentially going to UCLA. So when we're talking about the savings, not only of the human life, you know, which of course is the most important savings that we're doing here, but the actual costs of incarceration, I mean, it's a no-brainer. You know, women heal, and we're not even including in the cost savings the collateral costs of, you know, foster care, of the children's issues later on if they don't have that parent there. You know, if they're removed from that parent for 10 years, you know, the costs of the Department of Social Services, all of that other costs that have never been calculated in the cost savings. So, you know, it really is a no-brainer. In any circumstance, the treatment is less expensive than incarceration, but particularly for the women in the Women's Reentry Court with their more serious cases and their complex issues, we've saved a tremendous amount of money.
Yeah, and just those numbers alone are just the savings in prison. And you think about how many other systems these clients touch, you know, our medical systems, ERs, emergency mental health clinics, you know, over and over and over again, these systems are, you know, burdened because the clients aren't getting the adequate care that they need. So with this, I mean, if you look at the impact, just hearing Nicole's story, you know, in terms of how it's impacted her life and the way that she shared how much it has reached that she wasn't even aware, right? So not only her, but her family members and her extended family members, and everybody is impacted by it. And so let's go to the next slide. All right, so impact graduates have a lower chance of recidivism or being reconvicted. Compared their employment status before women's reentry court. Yeah, so tenfold. Like I said, some of the participants have maybe never even had employment. And when they leave there, they have a solid plan of either they're in a job or they're in school, striving for that job. It's a major component of the services that we're offering. Women who live with their children during residential treatment were more likely to complete. For sure. I mean, again, that's a huge component of this program and the success, especially for mothers. If they have, that extra motivator with them to ensure, when things get tough, they usually, that's usually why our moms will stick in, because they have that extra motivation. So I think, Nicole, did you have anything you wanted to add there?
Yes, I did, April. I wanted to add a couple things. I was one of those women in women's reentry court that was able to leave with a stable job. It was one of the groups that we went to was a career and development group where I was assisted with my resume making. I had access to a phone, a computer, so I can reach out to employers, and I was able to leave there with a stable job. The first time I had a stable job in a very long time. And from there, I was able to, I was encouraged and inspired to go to school. I see some people on this call right now that were my inspiration to go to school. Miss Sharon, she was working in the kitchen at the time when I was in treatment, and she would always talk about going to college, and she would talk about that she was taking. And I was like, oh my gosh, I want to be like that when I grow up. Like the light in her eyes just lit my fire, and that's exactly what I went to do. I registered myself for Mount SAC. I went to college, and what you were talking about, like the extension of the people's lives that my story reaches goes beyond even what you mentioned, my family members, my extended family members. I get to carry this story and this power and this passion to give back what was so freely given to me in my daily life, through my employment, through my recovery groups, through my friends, and through all of the residents, through all of the residents that I get to reach working in treatment and being able to be a counselor. And I have an opportunity now to become certified to be a domestic violence advocate and instructor, and to do parenting classes. And it's beyond, it's the biggest picture that I've ever, thank you for letting me share.
So amazing. Thank you for sharing. All right, next slide. So this chart just shows a little bit about the program impacts, health. So increased health determinants, health getting better, overall impacts on public safety, mental health system, chronic disease, all of those things are impacted in the sense that, our clients who are now in recovery are able to access, critical services that they need in order to be addressing, all of these things that prior to them being involved in the program were going unaddressed for the most part. Next slide. So hopes, dreams, reforms. So yes, there's lots of hope. This was a dream in the beginning when we came up with this, project, and the hope that, we could have this success, which, we definitely have, in serving almost, close to 3,000 women over the course of this program. But there's so much more that's needed, right? There's so much more that's needed to reform the system, to really look at true alternatives to, incarceration. And there's over, the last several years, there's been lots of effort to try to address that. And I think right now, especially right now, we're in a place where, entities who were previously very closed-minded to these ideas are starting to come around because the community won't allow them to think any differently about it. So I think we're in a perfect place to be able to, continue to offer this, but offer it to more people, because there's definitely lots of individuals who still are experiencing, chronic incarceration, going, cycling in and out of the county jail, that we really, need to increase our resources to be able to reach. Nancy, anything on that?
No, I agree. I think, the replication of this and in alternatives to incarceration, I mean, this really is the gold standard. Other programs that really focus on the trauma and on the pathways into incarceration and the healing will ultimately empty out the jail, to a large extent. And that's, this is the example of doing it right. And we definitely need more of it.
Awesome. All right, so just more. So in order to do more, we have to, continue to pursue funding that will support us in our efforts. And, as an organization, we do. However, we can always use support. I mean, like Nancy said, we've traveled, up to Sacramento, down, whoever would listen to us at a time when we couldn't keep this program stably funded. We're not in that place right now, but definitely in a place where additional funding can help us serve more clients. And that's always critical. All right, next slide. I believe the next slide is, does anybody have any questions or comments, or any final comments from you, Nancy or Nicole?
Do you want to go through the chat, April, or
I think I pretty much, Stacy, did I miss anything? I tried to incorporate the questions into our talk, but if I missed anything, Stacy?
Yeah, I think you got most of the questions. There was one early on that I'm not sure was directly answered. And it's, what are the actual requirements to participate in this program?
So requirements, from the treatment side, we screen only to see how we can provide the best service. There are requirements on the legal side that have to be addressed. So the referral, once we get the referral from the public defender's office, then we'll go out and do what we call a suitability screening. For us, as I said, suitability just means let's know everything there is to know about this client, so we can ensure that we provide the right support, and particularly around mental health and chronic health concerns. But from Nancy's side of things, there are some other things that have to be considered in terms of who gets referred.
And one of the things that I've loved from the beginning with working with prototypes is they worked hard to make clients suitable. So they would really dig in and do multiple interviews and try to find ways where they could figure out how to provide additional services if were needed, to make sure that client could get that opportunity for treatment. And that really didn't exist before. As far as legal means, it started off with a program where nonviolent felonies were generally eligible, subject to the program restrictions. In cases, for example, when a participant hurt a child, that would be up to prototype's discretion on whether or not they felt like that person could be safely treated in the community. So it's almost always about safety issues where prototypes would, have some concerns. But the court, and so serious and violent cases and cases with strike priors and serious and violent criminal records, they were subject to a case-by-case review by the DA bureau chief, who let almost all of them in. And so, and because those clients were so successful, we didn't really see a difference in the client's treatment based on their criminal charges. Their charges did not define them at all. The DA's office, after a while, said that, they dropped the review policy and agreed that if the referring DA, agreed and judge agreed to send the case, then, the DA's office was generally okay with it. And this again, this program opened the door in the entire criminal, justice world to to show that, there had been a presumption of prison, unless people went to trial. I mean, there's always, of course, the clients who go to trial on all of our charges. That's our primary obligation to our clients, is to vigorously defend them. But people charged with serious and violent charges, or serious and violent records and not serious charges, had a very, very tough route to get into an alternative custody situation. That only changed recently, where strike priors alone would make it very, very difficult, to sort of ensnare oneself in the criminal justice system. And the Women's Reentry Court, partly because of our extensive roadshows and our, constantly educating DAs and judges about what was happening, opened the door in the criminal justice system for further, for not only for a greater buy-in and understanding from everyone involved in the justice system, to opening the door for other programs and sort of a change of view of serious and violent charges and records being people who are untreatable and, can never be given the option. They're too violent, they're too this, they're too that to be successful in treatment. And prototypes show that that's simply not true.
Yeah. Yeah, I think every week Nancy was sending me an arsonist or something, just like I said early on, it was like she would look for the most difficult one and say, oh, just take a look, just take a look. Yeah. And 99.9% of the time we take a look and the participants would come in. So
we had a client who was facing the death penalty. She was a co-defendant on a death penalty case. She wasn't my client. And prototypes took her, of course. And she'd had massive trauma, and she wasn't my client, so I wasn't that familiar, but she was missing an eye. She'd been shot in the eye, among other trauma. And that client ultimately was extremely successful, became a role model in the program. I mean, she really turned the idea that, the violence means that you're a violent person. Violent charges mean you're a violent person. And, is another thing I really loved about prototypes, is that was what I really loved about them, is they were always willing to look at the human being and give them the benefit of the doubt whenever possible.
All right, so I just, as we wrap up, I just want to thank you, Nancy, very, very much for joining us today. And it's great to have this conversation and relive our beginnings of this wonderful project. And most of all, thank you, Nicole, for just your willingness to join us today and share your vulnerability and share your story. It's just amazing. You inspire me so much. And I think I'm going to have to keep my promise and keep trying to steal you away from that agency that's allowing you to be here on your lunch break. But eventually I would love to see you come and join our team. So thank you so much, everyone.
Thank you. Can I say one little closing comment?
Absolutely.
Again, I feel inspired. I feel inspired to be in the seats that everybody on this call is in. Like, to be a part of that someday is a new goal in my mind, and I thank you, April, Prototypes, Nancy Chan, Judge Tynan, Division 42, the drug court program, for being like the foundation from which I built my life. I mean it from the bottom of my heart.
All right, well, we can't top that. Thank you, everyone, for coming. Have a great day.
Thank you.
Bye.